So when a baby is born with congenital diaphragmatic hernia, or CDH, sort of the obvious problem is that there's a hole in the diaphragm and that the intestines and sometimes the liver or other organs are up in the chest. The obvious solution then is to push everything down and patch up the hole. One of the things that we've discovered over time is that probably the more important problem is actually the development of the lungs, and that when babies are developing with intestines up in their chest, it affects both the growth and the development of both of their lungs, and that even after you repair the diaphragmatic hernia, you're still left with lungs that are very fragile and very underdeveloped. One of the ways that we manage babies who have trouble breathing for multiple different reasons is with a ventilator or a breathing machine. And when we do that, we often need, in babies with underdeveloped lungs, we often need to use a lot of pressure or a lot of force to get the air into those air sacs. And one of the things that we know is that using a lot of pressure, a lot of force, can actually cause more injury to the lungs. So we feel that in babies with diaphragmatic hernia, there's the initial underdevelopment of the lungs, but then there also can be secondary injury and damage to the lungs from the treatments that we're using to try to help these babies. So one of the things that has really been focused on over the last 10 years or so is trying to use a different strategy. And instead of using our machines to try to sort of achieve perfection, to actually try to use our machines in a more gentler fashion to try to achieve adequate results, but not necessarily using very high pressures, and trying to limit the secondary injury to the lungs. So that the term gentle ventilation has really been coined as an approach to try to recognize that the lungs are not normal, and that asking them to achieve normal amounts of oxygen and get rid of normal amounts of carbon dioxide may not be the best treatment for babies. And so that we, as a field, we have respected the idea that we really need to look at these babies as babies with very special lungs that need to be treated in a very special manner, and that in using techniques that are as gentle as possible, still with the goal of trying to make sure that they are doing the jobs that they need to do.